Doctor Pollard. I'm a chiropractor here in East Brunswick, New Jersey, and I just want to demonstrate what we do with our hands and how we use them. Very important to palpate a patient's spine to identify the problem areas, and in order to feel the problem areas, we have to have very good tactile sense and feeling and be able to really locate the problem vertebrae to correct the misalignments and subluxations in the spine. So you can see the way that we use our hands in chiropractic and how important it is for me to really be able to feel what we need to feel to really deliver the best health care to someone. And you know, about 10-15 years ago, I was in school with you know, all the aspirations and hopes in the world to you know, go out and start healing people and really making a difference in their lives. And about 6 years in, I started to get numbness, tingling in my hands. I would notice it very infrequently to start, and you know, kind of said, well, it's just overuse. I'm really working a lot, doing a lot with my hands, and it'll pass. And the frequency started to pick up, intensify. The intensity, it would last longer. I started getting woken up at night, kind of once a night maybe. Just kind of shook my hands out, figured maybe I was sleeping funny. You know, circulatory problems with the hands and the fingers, and it would go away, and I would sleep the rest of the night fine. And you know, started to get more and more frequent, and I'd wake up more and more times through the night. And you know, I would start to get a little bit concerned because it wasn't going away. It was getting worse and worse. And being in the healthcare field and the education that we have, I recognized this as the signs of Carpal Tunnel Syndrome and realized that it was coming from what I did with my hands. So I decided to start investigating some of the common ways to get rid of it. And you know, the most common ones were to work on the muscles of the forearms and the wrists and hands and things to really make sure that there are no adhesions and that everything is doing well there, and to make sure that the wrists were adjusted properly so that the carpal bones were in the right positions, and the elbows and things of that nature, and you know, good diet, nutrition, things of that nature, B12 for the nerves, and still was having the numbness. So looked into the night splints, or the cock-up splints that people wear at night, and it was just bulky, it was tough to sleep, uncomfortable, so I was irritable, I wasn't sleeping well, and it really was not a good fit for me. So I went on the internet, Googled Carpal Tunnel Syndrome braces, and came across the Carpal Solution and spent some time on the website investigating the braces and the device that they had, and seemed like definitely a different approach. So I said, well, if I'm gonna consider this as a possible solution for my patients as well, I might as well try it first and really see if it works. So I ordered it. I spoke with Karen at the 800 number, and you know, she told me about the product, and I said, sounds great, let me get started. She sent them out. I had it very quickly, within, I don't know, 3-4 days or so. It didn't take long to get it. Looked at it, and when I got it, I said, I don't know how this is going to work. I said, this doesn't look, you know, I said, well, let me try it, because the results, you know, speak for themselves according to their website and all the things that I had seen. So put it on, and was pretty comfortable. I you know, didn't feel cumbersome, I didn't feel restricted, I didn't feel like I had to sleep in a certain position to not have pressure, and woke up the next day. I was still woke up a few times that night, woke up the next day and still had the numbness, and I said, wait a minute, this is supposed to take away the symptoms. So I read the inserts of the packaging again and again, and you know, it said, oh, sometimes, you know, it'll take a day, it'll take a couple of nights before it starts to kick in. So within 2 nights of wearing it, I slept through the whole night and woke up the next day, and I said, wait a minute, I didn't wake up last night, and kind of was pretty surprised, actually. I said, wow, these things must really be starting to work. And I said, okay, I'm glad, you know, I was really encouraged. I said, I found something that's working. It's not prohibiting me from sleeping. It's not costly. It's not expensive. And I'm allowed to work. And at the time, my wife she was not working. We just had a young baby. So she was home with the baby. So I was the only one, you know, really working at the time. So I had to make sure that I was still able to go to work and provide for the family. So it was important that my hands, especially not just for my own well-being, but for my patients' well-being as well, most importantly, was to make sure that my tools worked the way they are supposed to work. And so a couple of times before I had the braces, I would, get up in the middle of the night to get our son out of his crib, and my hands were numb, and, felt like I was going to drop him a few times. Pretty scary, as you can imagine. And, now I can say that because of the Carpal Solution that I've used for the 6-week program that it comes with initially for both the left and the right hands, I have not had a problem with my hands with numbness, tingling, loss of strength, anything like that in probably 4 or 5 months at this point. And so now we do the maintenance program just like I would do maintenance program with my patients for their spinal health, and this is for my carpal health, and it really seems to work out really well. So I've had nothing but positive results. I've had patients that have had carpal tunnel syndrome diagnosed with EMG testing at neurologists, and they've been to surgeons and orthopedic hand specialists, and they've worn the braces, they've had surgical consults, and I've turned them on to the Carpal Solution, and they've done really well with it. People that have gone and have used it have come back to me and said, "This is great, thank you so much. Really made a huge difference. I was signed up for surgery. I was in 2 orthopedist offices last week, and it's given them some of their life back as far as they can drive their cars, they can do the things that they are accustomed to doing, spending time with their families, and not having to worry about not being able to enjoy themselves." And for me, it's made all the difference in the world, only because now I don't wake up thinking, okay, am I going to make it through the day without having to stop? Am I going to, jeopardize, my work or someone's health potentially because I can't feel what's happening, or I can't, grab or have the strength to do what I need to do? And thank God, everything's been terrific. So I really am grateful for finding this product, and it's a great solution for this. And that with proper education and really understanding the condition and how to mitigate the symptoms and how to really lessen the severity in addition to using the product correctly, it's really been terrific. The insert has all the information that you need in order to apply the product. There's 3 easy steps, nice, easy, clear pictures to demonstrate for you so you have no questions. They come in both right and left hand models. This happens to be for the right hand, but the packaging insert, very nice and compact. It comes with this plastic bag, so the product stays dry, it doesn't get wet. It fits right into your nightstand drawer right next to your bed, so you can put it on right before you go to sleep. And the protocol is important with these because you get 28 devices in each pack, one for the right, one for the left, and it's I think it was 2 weeks every night that you wore it, and then every other night. And it takes about 25-30 seconds per hand to apply it, and it's really not that difficult. The protocol is important to follow, and it explains here why a 6-week protocol is important, but really the basics is that you're going to feel better before the time is up of the 6 weeks, but you still have to finish the protocol in order to get the results that they are known for with their product, because the protocol is important, just like an antibiotic or something like that. You need to follow the protocol to get the results that you're looking to get. And if you're looking to get the results like they have and they come, you need to really follow that protocol, which is important. So I'll demonstrate how to put it on. When I first opened the package, when I first got it, I looked at this and I said, "You've got to be kidding me. There's no way this is going to help my carpal tunnel." And I said, well, let me give it a shot. The results speak for themselves in their literature, so I did, and you heard my story, and it works. So you can see there's 3 easy tabs here that go on. So just to demonstrate, you just kind of pull off the backing, and if you have smaller hands or bigger hands, it's very easily adjustable. I just kind of tear a little bit off. It goes real quick, and we apply it to the hand, and it just goes right around onto your palm. And now we attach the other side, and it just comes off nice and easy. And again, you just pull it tight. The hole on there gets stretched so that you have the right tension. This comes around your thumb onto the other portion of your palm, and if it's a little too long, just a little tear of the tape, it rips very easily. You don't need any special scissors. Just press it down, and now the last strap goes right on. You just take the backing off, a little bit of tension, and just to tear the tape lightly. And now we have the 3 points of attachment here, which spread open the carpal tunnel where that median nerve comes through. And I have not had any problems with the tape coming off through the course of the night. I've woken up, and in fact, sometimes when you take it off, you still feel some of the adhesive on your hand, so that's how good it actually stays. But that just provides the gentle stretch that you need. It's a nice, simple, easy solution, and very comfortable. You can move, you can do whatever you want, and you don't have to worry about being really restricted. So the proper tension is applied when this little circle in the middle becomes an oval. And as you can see on my hand, it is now an oval. When you get the Carpal Solution and it is not applied, you can see that it's just a plain circle. So that's how you know you're providing the right amount of tension and to get the proper stretch, the proper relief. And what I want to show is where the carpal tunnel actually is. Most people think that it's down here in their wrist. However, it actually is up in here. And the carpal bones of the wrist, the 8 carpal bones, form a tunnel that median nerve comes through. And with a lot of use, repetitive motion type injuries, those carpal bones, you get a lot of inflammation in there. And the Carpal Solution will apply tension from 3 key points to stretch out and open up that entire carpal tunnel. And by doing that, you increase the circulation of fluid, of blood circulation and lymph flow, and also you allow the blood to bring in proper nutrients for healing, and also to allow the inflammation to leave the area so that healing can take place. So it's very important to have those 3 contacts, and it doesn't have to be right here, right here, right here. In the area is good enough, so it doesn't have to be complete accuracy when you put this on. When I first got it, I looked at the picture and I said, okay, I have to get it right here, right? But even if you're just in the ballpark of the area, you still get the right compression, the right traction on the area, and it's really pretty foolproof. This tells you when you have the right tension, and as long as you're in this part of your hand, this part of your hand, and this part of your hand, you're going to get that 3-pronged approach to stretching that carpal tunnel correctly. Chiropractor, to me, this product makes a lot of sense. It really does. It's so simple and effective, and you know, after reading the information here and not being a chiropractor, I could, you know, my wife even read it and she could understand how this really works. And so you don't need special training or anatomy or physiology to really get how this you know, stretches that carpal tunnel area. You know, my wife, she teaches yoga, and she does a lot of stretching with her students, and the stretching is important to allow circulation to the muscles, to allow them to really benefit from the yoga, to heal, so they're not tender, so they're not sore. And this is the same thing, but it's a sustained 8-hour stretch over the course of a night, and most people should be getting between 8 hours of sleep a night, and if you put this on for that entire 8 hours, you're really getting a lot of stretch. I mean, if you can imagine holding a stretch in your hamstring for 8 hours, you'd probably have a pretty loose hamstring come the next morning. So this really does a good job at opening this up, taking the tension away. That inflammation, once it's gone, the symptoms of the carpal tunnel disappear. That numbness, that tingling, you know, the loss of strength, the sleeplessness, the pain shooting up the arms, the inability to hold things, dropping your keys, not being able to write or, you know, hold your pen or do any of those things. Or for me, it was, you know, my son. And, you know, when it hits that close to home, I said, I need to do something about this. And this was the solution for me, the Carpal Solution. And I would definitely suggest that if you're having these symptoms, if you're disrupted sleep due to hand numbness, if you're constantly shaking your hands, if you're on the computer all day and you can't hold the mouse or you can't type, this is a very inexpensive alternative to damaging surgery, which the research shows is only effective part of the time. And the research on the carpal tunnel is a 97% effectiveness rate. So really, this is a less invasive way to go, a much more easier on your lifestyle. There's no downtime from it. There's no loss of work. There's no, you know, you don't lose anything by trying this first. So it's a definite great product, and any of my patients that come in from this point, or even going back to when I used it, you know, since I've used the Carpal Tunnel Solution, this is what I recommend to them. And they come back and tell me that, well, yeah, I've had those hand braces, the night splints, and this has worked much, much better. So this is a great product, and I will continue to use it as well as recommend it to my patients.